Shubha Shanivar. I am Dr. Rashmi. I am the founder and CEO of Aishvi Health Private Limited and Book My Ayu. So today I'm an MD in preventive medicine. So let's learn about preventive Ayurveda today. And the topic is very interesting topic about Panchakarma detox. So let me just take you through our panel of Ayurveda doctors who are with us. Right. The agenda of today's webinar will be something like this. Let's get introduced to Panchakarma, overview of Panchakarma therapies. What are the stages of Panchakarma therapy and each of the therapies in detail? So as you understand, Panchakarma are 5 type of therapies. Let's learn each of them. And what are the case studies? So we have a good number of case studies to, give you the proof, and we have testimonials, we have research studies, and lastly, the floor will be open for Q&A. So we have with us Dr. Gopalakrishna. He is BAMS and MD. Namaste, sir. MD in Kaya Chikitsa with around 37 plus years of experience. He is a veteran in the field of Ayurveda. He has been a PG guide for research studies, and he has handled thousands of cases in his practice. So welcome you, sir. And we have Dr. Ramya. She is also from BAMS, and she is an Ayurveda physician. Hi, Dr. Ramya. Good morning. So she's also specially trained in the field of nutrition. She has 12 plus years of experience with special interest in managing lifestyle diseases and nutritional issues. Then we have Dr. Suraksha. She is BAMS and MD in Panchakarma. She is a gold medalist in Panchakarma and an Ayurvedic physician with 2 plus years of a vast experience through her MD days, and also with her current experience. Welcome, Dr.
Namaste. Namaste, Dr. Rashmi.
Namaste. So, can I request Dr. Suraksha to take you through the slides?
Yeah, sure. Okay, namaste, everyone. So, we'll start the session with interesting case. That is, we'll have a glimpse knowing that how Panchakarma can treat a wide range of diseases. That is, it is having the multimodal actions starting from the acne up to infertility. Very wide range of diseases can be effectively treated through the Panchakarma. So we'll have a glimpse of one of the cases which is successfully treated through the Panchakarma in the beginning, so that you will have more interest towards the session. So this is a case which I'm going to explain. A 33-year-old female with unexplained infertility failed 2 IVF cycles. That is, this case has approached us with these complaints. So effectively treated with the Basti therapy, that is medicated enema, which is instilled to the anal region. This is one of the therapy of Panchakarma. So effectively treated case through the Basti therapy, and followed by repeated follow-ups, giving the Rasayana with the Shatavari Grita, as well as installation of the medicated oil through the nostril. That is called as Nasya therapy. So this case was successfully treated with the 5 months of course, and the female conceived naturally within 5 months of Rasayana, and stress also is relieved. So this case, it highlights how Panchakarma can be effectively working in the cases such as infertility also. So I'm going to start the session with this case. Okay, going on to next slide. Okay. So introduction to Panchakarma. So what and all we'll be seeing throughout the session, that is Panchakarma, Shodhana therapy, what we call as core detoxification. It includes 5 main therapies followed by other sub-therapies. So how Panchakarma will be more effective, like why it has been given the importance in Ayurveda. So mainly Panchakarma is nothing but our Ayurveda theory. It mainly tells us that there are 3 pillars. That is Tridosha, Saptadhatu, and Trimalas. So this is governed by sub-pillars, like whatever the diet patterns, what we call, that is called as Ahara, then Nidra, sleep pattern, as well as Brahmacharya, that is conduct as well as the sexual activities. So any impairment or imbalance in these three factors can lead to the vitiation of three doshas, that is called as Vata, Pitta, Kapha. So Vata is nothing but which is responsible for the movements in the body. So we can widely consider it as joint movements as well as neurological conditions. These and all comes under Vata, whereas Pitta is mainly responsible for something which is hotter, that is something which is related with the gut, which is related with the hormones, which is related with the digestion. So digestive fire is called as Pitta. Whereas Kapha is nothing but what and all the water content in the body which are present, which is sluggish in nature, that is considered as Kapha in a broad term. So any imbalance in these three can lead to wider range of diseases in the body. So to correct this, Panchakarma mainly aims at throwing out, that is, it is mainly helps in cleansing these vitiated tridoshas, bringing them into the balance and curing the diseases. So aimed at restoring balances of Vata, Pitta, and Kapha. In Ayurveda, what we tell us, see, any tree which is cut from its root, so there is no chance of regrowing. In the same way, Panchakarma mainly aims at removing the root cause. That is, it helps to remove the root cause, curing it from the very deeper thing, and also it helps in avoiding the recurrence. So Panchakarma benefits includes removing the root cause and preventing the recurrence of the disease. So it also helps in enhancing the absorption and efficacy of the medicine. So certain conditions, without cleansing the body or without bringing the metabolism into normalcy, if we directly administer the medicines, then it will not have that much of effect. So that is why Panchakarma is given in the beginning to cure wide range of diseases, followed by the proper follow-up, and so that it will help in increasing the efficacy of the medicines. And indirectly or directly, it brings the restorance. That is, your body will come into the normalcy. So in certain conditions, like say it is in case of infertility or in case of very chronic metabolic diseases, so Panchakarma is mandatory before taking any of the oral medications. So these are the wide range of benefits which we can see under Panchakarma. Moving on to next slide. So what is Panchakarma? So Panchakarma is nothing but that is a therapy which includes 5 main therapies. That is, first one is Vamana. So Vamana is one of the important therapy under Panchakarma. It is a first main therapy, that is nothing but the therapeutic emesis. Second one is Virechana. Virechana is nothing but throwing out the metabolic toxins through the anal route. That is a purgation, what you are giving. So that is called as Virechana. Third one is Basti. In Basti, we have 2 main categories, that is Niruha Basti as well as Anvasana Basti. Niruha Basti is nothing but installation of the medicated decoction through the anal route. So that is called as Niruha Basti, whereas Anvasana Basti is nothing but installation of the lipid media in the form of oil or ghee through the anal route. So that is called as Anvasana Basti. So these 2 are considered under the Basti. Last one is Nasya Karma. Nasya Karma is nothing but installation of the medicated drug through the nose in the form of oil, ghee, powders, kashayam. So this is called as Nasya. So these are the 5 main therapies which are included under Panchakarma. So it is called as Panchakarma. Pancha means 5, Karma means treatment. So these are the 5 main therapies that are included under Panchakarma. Going on to next slide. So what are the 3 stages of Panchakarma? That is how it can be conducted. So any procedure will have the 3 stages, like how it has to be performed. So initially we have Purva Karma. Purva Karma includes all those procedures which are performed before the main therapy. It is called as pre-operative phase. So it includes 2 main therapies called Snehana as well as Vedana. Why these 2 therapies has to be included? Because our body has to go through certain procedures to prepare for the main karma, that is called as Pradhana Karma. So Purva Karma includes Snehana, which is applying the oil in the form of different methods. So it is called as oleation. Whereas fermentation is nothing but you are applying heat to the body. So these 2 karmas are required to prepare your body for the main karma, that is Panchakarma. So middle one is Pradhana Karma. That is a main therapy, which includes all those 5 procedures which I have explained before. So these are the main karmas. Whereas next is Paschat Karma. That is a post-operative phase. So post-operative phase mainly includes diet, as well as rest and lifestyle adjustment. So our body will undergo little strainful procedure. So in order to bring back the body to the normalcy, we have to undergo certain diet, we have to take rest and do certain lifestyle modifications. So these are the 3 main stages of Panchakarma, that is pre-operative phase, main therapy phase, as well as post-operative phase. Moving on to next slide. So what are the benefits of Panchakarma? As I have explained earlier, it has a wide range of benefits. In Ayurveda, we mainly tell that, so benefits of Panchakarma are explained wide range. That is, evam vishuddha koshtasya. That means deep detoxification. So what and all toxins which are attached to the channels will be removed out through the Panchakarma procedure. So kayagnir abhivardate. That means which enhances the digestive fire, strengthens the digestion as well as it enhances the metabolism in the body. Then it helps you to delay the aging. That is what is explained in Sanskrit as Jaram Krichrena Labate. That means it will help you to look more younger. Your body will become more lighter after Panchakarma. Your skin texture improves. So this helps in delaying the age. Whereas it boosts immunity as well as vitality. Naturally, our body immunoglobulins will be enhanced so that all your channels will be cleared with the toxins. So boost immunity as well as vitality. Indriyena, Thriti, Buddhi, all will be increased. That means mental clarity and emotional balance. Most of the people approaching to us will be more exposed to stress these days. So Panchakarma also helps in enhancing the mental clarity as well as it helps you to balance the emotional status. Whereas it improves the skin health, as also mentioned in Ayurveda, as it improves the varna. That is, a complexion will be improved. So skin looks more glowing, skin health will be improved. Any diseases which are related to skin can also be cleared by taking the Panchakarma procedure. So these are the wide range of benefits that are present, given after the Panchakarma procedure. So patient can observe this once after taking the Panchakarma with the doctor's guidance. Next slide. So Vamana. Now we'll go to the first procedure that is called as Vamana. So what is Vamana? Vamana is nothing but that procedure which includes the throwing out of the toxins out of the body through the upper body part, that is through the mouth. So when it is done, when Vamana is done, so in Ayurveda, we tell that with upper body part is most predominant in kapha dosha. So all those diseases which are related to kapha dosha, that is vitiated kapha, is thrown out through the mouth through the proper follow-up and proper guidance under the doctors. So Vamana is the first procedure where toxins are thrown out through mouth. So in general, we can call it as the MSS. That is, medications are given and doshas are thrown out through the mouth. So it is predominant in kapha conditions like skin diseases, asthma, and respiratory conditions like bronchitis, in case of sinusitis. So very wide range of benefits through the Vamana we can see. So what are the indications of Vamana? So where it can be given? So before conducting the Vamana, they have to take the doctor's guidance, and once they have taken the doctor's guidance, once Vamana is indicated, those people who are very fit to perform the Vamana, like they should be of the good age, that is they should be fit for the conditions, and they should have the good amount of kapha to be thrown out. So people with excess mucus is mentioned as the first indication. So sluggish digestion, and in case of skin conditions, and in case of respiratory conditions like bronchitis, bronchial asthma, then metabolic conditions like hypothyroidism, PCOD, all these conditions we can treat it effectively with Vamana. So when is Vamana done? It can be done throughout the year under proper guidance, supportive with the condition, external environment, but typically it is indicated in case of spring season. So spring season, even a healthy individual who is not suffering from any kind of disease, naturally the kapha dosha will be increasing during the spring season. So during spring season, even a healthy individual can undergo Vamana procedure. So when it is contraindicated? So when Vamana is contraindicated, contraindicated, especially in small children, because their body will not be that much fit to perform that procedure. So in children, in elderly people, in lactating women, as well as in pregnant women, very dehydrated people. So in such people, the Vamana is mainly contraindicated. Also, people who have undergone recent surgeries and who are having the bleeding disorders. So everyone has to consult the doctor. Under the proper guidance, one can undergo Vamana procedure. So going on to next slide. So these are the benefits of Vamana. Vamana is one of the important first procedure which is explained. So going on to Virechana. So as you all heard already, Virechana is nothing but it is one of the important detox therapy where doshas are thrown out through the anus route, that is through purgation. So this is one of the important therapy which is practiced widely everywhere. So Virechana is more easier compared to that of the Vamana. There is less strain compared to that of Vamana. So Virechana can be performed easily. So what is Virechana? Like when it is performed. So Virechana is conducted in those conditions where there is excess of Pitta dosha in the body. That is where excess metabolism is affected, digestion is affected, something related more with the Pitta dosha. So somewhere like jaundice and liver conditions, then gut related conditions, GERD, gastritis, dyspepsia. So in all these conditions, Virechana can be performed. Even in the long-term chronic autoimmune diseases, Virechana plays a very major role. Virechana also has a role in case of conditions like obesity, PCOD, then acne, where Pitta dosha is predominant. And people who are not fit for Vamana, we can throw out these excess metabolic toxins through the anal route easily, so through purgation. So Virechana is also performed in those people where they are not fit for Vamana. So indications, as you can see in the slide, it is indicated in wide range of skin diseases as it will purify the blood. So it is indicated in psoriasis, eczema, then hyperacidity, liver disorders, jaundice, in case of gallstones, migraines, allergies. These are the wide range of conditions where Virechana can be performed. We have successfully treated many of the conditions through the Virechana in Ayurveda platform. So Virechana is one of the widely practiced karmas. So contraindication, again, it is similar to that of Vamana. So in very small children and also below 12 years where there is no proper development, in such people, Panchakarma will become little difficult to perform. Elderly people who are above 65 to 70 years, pregnant and menstruating women, and who are under severe dehydration, and something to related with cardiac conditions and very chronic diarrhea, rectal bleeding. These are some of the contraindications where Virechana cannot be performed. So moving on to next slide. So Basti Karma. So Basti is third important Panchakarma procedure which has been explained. So under Basti, I have told there are two types. That is, one is Niruha Basti, that is medicated decoctions are instilled through the anus, whereas Anuvasana Basti, where medicated ghee or any lipid media, it is instilled through the anal route. So Basti is also widely practiced because most of the neurological condition, joint diseases, autoimmune condition, where allopathy has limitations, in such condition, Basti plays a very major role, especially in conditions like sciatica, in conditions like osteoarthritis, in conditions which are related to brain, something to do with the brain, and conditions of gut like ulcerative colitis. So it also has a wide range of benefits. So we can see the indications what is mentioned: constipation, bloating, arthritis, sciatica, neurological diseases, something related with the skin like dryness, so insomnia. Again, Basti can also be given along with a combination of Virechana. That is, first we can go for Virechana or Vamana followed by Basti Karma. Again, it depends on the physicians and what is the severity of the disease, chronicity of the disease. When the patients come, we can properly analyze and then give the Basti Karma. Even in the small children, we can practice a Basti Karma called Matra Basti, also in elderly people, where very small dose of oil or a small dose of ghee is instilled through the anal route. So it is performed in 3 sessions, that is for about 8 days, that is called as yoga basti, for about 16 days, that is called as kala basti, whereas for 30 days also it can go up to, that is called as karma basti. So basti not only helps in removing the metabolic toxins, it can also be given for the enhancement of the nutrition, for the weight gain. Those who are very weak, by instilling the oil or lipid media, the gut can easily absorb and it helps to gain the weight, as well as in elderly people where their skin becomes very dry, where they don't have proper metabolism, where they have the constipation and the stools doesn't pass properly. In such cases also, it is a medicated enema which is given, not like a soap water enema or any other enema which is only given to pass motions. This does the overall benefit to the body. So basti is one important one. So contraindications, again we have to see long-term diarrhea, bleeding disorders, or dehydration, pregnancy. In such people we have to monitor and then go for the basti karma. Moving on to next slide. So Nasya. Nasya is nothing but it is last one, which is among the Panchakarma. So Nasya is the installation of the medicated drugs through the nose. Say it is oil or ghee or powder or kashayam. So there are variety of Nasya karmas that are explained based on their benefit, based on the dose, and based on the medications what is used. So why this Nasya karma will help? All those diseases which are related to your upper body part, in the form of any diseases that are related with the head, ear, nose, and something to do with the cervical neurological problems. So all these cases can be treated effectively with Nasya Karma. So Nasya Karma purpose is to cleanse the nasal sinuses as well as to improve the brain functions. This is a wide range of benefit which is seen. And the diseases which are related to head, neck, and sensory organs, these are treated through Nasya Karma. So where and all it is mainly indicated, widely we practice in sinusitis, migraine, rhinitis, long-term headache, unexplained headache, memory loss. Whereas in case of stroke patients, where upper body part is mainly affected, and those who are having the loss of muscle mass, and in such people, Nasya Karma is mainly practiced. So contraindication, again, it depends on the condition of the patient, who are very, very debilitated, who are not fit for Panchakarma, and children who are below 7 years, and during the menstruation also, there is a hormonal imbalance will occur if we give Panchakarma during the menstruation. So that is why it is avoided. Whereas in case of sinus infection, acute rhinitis, so very in acute condition where there is inflammation, Nasya cannot be given. So in the later stages, to treat the long-term conditions, Nasya can be given. So Nasya also has a wide range of benefit. So this is also one of the important Panchakarma procedure that is widely practiced. Moving on to next slide. So Rakta Mokshana. Rakta Mokshana is nothing but the bloodletting therapy. So even though Rakta Mokshana is not included directly under Panchakarma procedure, it has a wide range of benefit. The main reason for not including it under the Panchakarma directly is it only has a benefit of removing out the excess toxin. It does not provide more nourishment to the body. Rather than providing nourishment, it helps you to remove the excess toxins from the body. Panchakarma has both nourishment action as well as removing out the doshas, whereas Rakta Mokshana is mainly helpful in removing out the toxins from the body, especially in the diseases where the blood is affected. So in the conditions of wide range of skin diseases like psoriasis, in case of varicose veins, in case of hypertension, where blood is a main culprit, leech procedure is leech or venesection. These are all considered under Rakta Mokshana. So these therapy can also be included on Panchakarma, but it has a limited benefits. So purpose of Rakta Mokshana is to eliminate the impure or stagnant blood, and also treat the pitta diseases as well as where blood is affected. So it is indicated in gout, it is indicated in hypertension, headaches, and also simple problems like acne can be effectively treated with the Rakta Mokshana, where we use leech therapies, we use venesection in varicose veins. So immediately the patient will have the relief. Like within 1 to 2 days when the patient is suffering with the varicose vein pain. So by doing the venesection, immediate relief we can see. So that is a advantage of Raktamokshana which is performed. So it is mainly contraindicated in the anemia patient, whereas in case of hypertension, pregnancy. So in such cases, we have to monitor, do the proper investigations, and blood investigations has to be done, and then we can go for Raktamokshana. So even though it is not directly considered under Panchakarma, it is also a sub-variety of Panchakarma which is widely practiced. So it has the wider range of benefits. So these are the case studies which will be explained further. So Panchakarma, I'm just going to conclude by saying that not only it removes the toxins, not only it removes the vata, vitiated vata, pitta doshas, it also helps in absorption of nutrition. It also helps in improving your mental clarity. It also helps in bringing the lightness to the body. And the main purpose is it avoids the recurrence of the diseases as much as possible, and also dependency over the medications can be much reduced when we go for Panchakarma before. So if we go Panchakarma, take the Panchakarma properly under the guidance of the physician, and later if we take the medications, it will be more beneficial. So Panchakarma has this wide range of benefits, starting from the acne until the chronic diseases like PCODs and infertility, autoimmune diseases, very chronic diseases. So a very wide range of diseases can be treated effectively through the Panchakarma. So I guess Ramya will take over the case studies.
Yeah. Good morning, everyone. Thank you, Dr. Suraksha. It was a good session explaining in deep about Panchakarma. So we will move on to the case studies. Like I have mentioned here, few case studies. In Ayushvi, we have done many cases, and also from Book My Ayu also, we have seen many patients. So with a patient with 39 years old, having medical condition like diabetes, dyslipidemia, fatty liver, we had given Virechana treatment for 10 days. Post that, internal medications for diabetes and dyslipidemia was given. So within post Virechana itself, we could see a very good amount of improvement in the fasting blood sugar levels, which dropped from 180 to 140. And also we could see a very good amount of weight loss in him. Okay. And apart from that, we have also treated cases like infertility associated with PCOS with Virechana treatment, Uttarabasti, and also Rasayana therapies, where menstrual cycles were regularized, and also the patient conceived within 5 months naturally. And apart from that, when moving on to the Basti treatment also, we have given for a child of 18 months who was like unable to stand and walk, used to walk only with the support. Matra Basti was given, followed by Sarvanga Abhyanga and Shashtika Shali Pindasveda. It is a type of fermentation where Shashtika Shali rice is used. Apart from that, internal medications were also given, and within now, like within a span of 3 months now, we can, like, the baby is able to walk and also run. Apart from that, a migraine case we had treated, 38 years female, where Nasya Karma was given along with internal medications, and within the post 3 weeks of the treatment, migraine attack were not there, and also no relapse of the symptoms since 6 months. Moving on to the next slide, please. And we have also treated many chronic sinusitis allergy cases where Nasya has helped a lot, and also with the internal medications, like within span of post therapy, there were no relapse of the symptoms. Apart from that, hair fall. Nowadays, you can see many of face this hair fall issue due to multiple problems, and maybe it is due to nutritional deficiency or hormonal imbalance. So we had treated the patient with Shirobhyanga, and also post that Nasya treatment was given, and also internal medications like Amlaki, Rasayana and all were given. So hair fall reduced significantly by day 15 of the treatment, and also new hair growth noted after 15 days. After 3 weeks. Yeah. So apart from that, also we have treated a case of irregular menstruation also, with weight gain and all. So Vamana Karma was given, and apart from that, internal medications were also given. So within the span of 3 months post therapy, the cycle got regularized. And primary infertility associated with the PCOS of a 29-year-old female also we have treated, where Deepana Pachana were given post that Vamana Karma was done. So we could see a good amount of change in her, like her cycle got regularized, and within 6 months she conceived naturally. Moving on to the next slide. So there are, like, if I keep on going telling, there are multiple case studies which we have. We have also treated a psoriasis case where the Vamana Karma has helped a lot. And apart from that, we see a good amount of change post the therapy, like a reduction in the skin lesions, itching, and also scaling. No flare-ups were seen like 2 months even after the therapy, and improved in digestion and energy levels as well. And also for pimples and all, we have seen a good result where 46 years female had come with multiple pimples, and especially on the face. So this leech therapy, what Rakta Mokshana Dr. Suraksha explained, that also were done in inflammation got reduced, and also significant reduction in the new pimples and redness even by third session of this Jalauka, that is leech therapy, we could see. Yeah. Moving on to the next slide. Yeah. So these are the testimonies which patients have got done treatment through Book My Ayu. There are various patients, like in this diabetes are there, weight loss, PCOD. So for all these patients, Virechana were given, and we could see a very good improvement, whether like in Shruti, where migraine got drastically reduced in her, where Divya's PCOS got resolved, and also we could see a good amount of change in Nitika's skin, where she had complaints of urticaria and skin allergies, and also irregular cycles for Dr. Arya got resolved with the help of this Panchakarma therapy, that is Virechana. Moving on to the next slide. Yeah. So research, when coming on to the research studies in Ayurveda, especially for Panchakarma, there are multiple research.
Dr. Ramya, just sorry to interrupt. I think Sri Lakshmi needs to take over here.
Okay.
Yeah, thank you, doctors. I was so deeply immersed in the session. I also recently completed my yearly detox, and I was just looking at the benefits, beyond what I am aware. There are huge benefits. Thanks for a very enlightening session. Now coming to Book My Ayu, what we have today with us. We have partner centers across Bangalore, and we also do provide online services and offline services, both through Ayushvi and through the help of partner centers. So Book My Ayu is a platform wherein it helps connecting authentic Ayurveda Panchakarma centers across Bangalore. Not just that, we also have wellness retreats. So if someone is looking for staying there in a retreat, getting the treatment done, or go there, relax, rejuvenate, and come back, yes, we can guide you. And yeah, we can move on to the next slide. If we recall whatever health concerns we just spoke about, right? Every health concern is listed here. We can treat right from digestive to respiratory, musculoskeletal, skin related, neurological, mental health, metabolic, women health, plus enhancing the beauty through Ayurveda. So any of these can be addressed through Ayurveda and through Book My Ayu. Along with this, we also want to talk about Ayushvi. Ayushvi is an online Ayurveda service provider, wherein we can arrange online doctor consultations, at home blood checkup through NABL accredited labs, and report will be available within 24 to 48 hours. And we also do provide diet and nutrition plan, which is also reviewed by the doctors. So these are the different services what we can offer. We have next slide. Yes. Yeah, we are very excited to announce an offer here. It's a spot offer. Ayushvi, if you see the QR code here, it's Ayushvi Health Private Limited. However, Book My Ayu is a platform which is sponsored by Ayushvi Health itself. And Book My Ayu offers a subscription. The subscription is not free. It comes with the cost. However, in this we are offering a subscription just at ₹1, which is valid for 6 months, and you get 30% discount on any of the therapies for 6 months. So it's a great offer. Make use of it. You can scan this QR code, what is displayed here, and avail the offer. Please go for it. Okay. Do we have the next slide? Yeah. Over to Dr. Ramya.
Yeah.
What
Thank
is
you.
the total fees of the therapies? Average fees of the therapies for a month or maybe 6 months?
Yeah, I think I can take this question. See, it depends upon each health condition and the individual, right? For some person, Virechana may be needed. For somebody, Nasya may be needed, or for someone, Vamana may be needed. So based on that, it differs.
Mhm.
So, and as you know, we have partners collaborated with the partner centers, right? So each of the centers, say for example, those which are close to your home, there may be 5 centers. So little bit price difference is there in each of those centers. And if you're taking the Panchakarma detox online through us, that will be you can take it at home. Only for the massages we will send you to the partner center. So that also ranges. Our own fee will be around 10,000 rupees, but currently there is 30% off. And for the massages also, it will be around 6,000 rupees for 3 days. Again, you will get the 30% off through this offer.
Okay. Okay. So average is 10,000 for a month, right?
See, every month you need not take Virechana or, those kind of things. But if it is Nasya, if say, for example, somebody has migraine and we suggest Nasya therapy for 7 to 8 sessions, so that can be repeated every month. So every month the cost will be somewhere around 16 to 20,000. So a 30% is a huge offer there.
Okay. Okay. Yeah.
Okay.
Yeah, thank you. So moving on to the research studies on Panchakarma, there are numerous research studies where it has stated that, like for example, in PubMed also it is published like a condition like irritable bowel syndrome where Panchakarma treatment were given, and also could see a greater relief in symptoms in stool consistency or pain intensity. Apart from that, in osteoarthritis also we could see a very good amount of result, and also in skin disorders also it is published in PubMed, and also diabetic retinopathy where the individual Shodhana therapies have helped them. Apart from that, in hemiplegia, stroke kind of disorders also, Panchakarma has helped a lot. All these are like research published in well-known international journals and all. Yeah, moving on to the next slide. And also certain studies like rheumatoid arthritis, like autoimmune condition, and also in Nasya treatment, everything were published in the international journals and ResearchGate and all, where we could see a good amount of result in patient conducted for various patients. Yeah. Moving on to the next slide. Yeah. Yes. Thank you, everyone. Yeah. So
Yeah,
I
thank
think,
you.
yeah.
Dr. Ravi, do you want to add on?
Doctor, I have
Thank you. Yeah. The floor is open for questions. Like anyone is interested, they can ask questions.
Yeah, please.
Can we do Panchakarma for arthritis problem, doctor?
I think
I'm Dr. Gopal Krishna. Let me tell you. Basically, arthritis problems are related to the Vata related problem. As we, in the beginning itself, it has been elaborated that the
Okay.
best therapy for Vata is the Bastis. Basti karma that the animata, medical animata given, gives a wonderful result, whether it is rheumatoid arthritis or osteoarthritis. Whether it is senile arthritis, osteoarthritis, or it is rheumatoid arthritis related to the autoimmune disorder. In all such conditions, yes, Panchakarma gives a wonderful result when compared to the allied science, which is giving the results or management of the condition with only either surgery like replacement of knee and such things, or with the medication, painkillers. Painkillers have got a lot of side effects. Long-term use of those things are not recommended. Whereas through Panchakarma, we give wonderful results. The management of arthritis, yes, we have wonderful results.
Okay, doctor. My cousin, she's taking medicine for arthritis. She's taking allopathic medicines. So, can she continue with that and do Panchakarma as well, doctor?
Continuing with that, we need individually a case for what has been treated or which has resulted in the manifestation of arthritis needs to be considered. Your cousin, you are telling, and then for what are the drugs given also needs to be evaluated. Second thing. Third thing, many a times it so happens they need not continue to take the other medicines what they are taking. We can just switch on to only the Ayurvedic medication, and then Ayurvedic medication with Panchakarma and all that, the local application will give you a lot of relief and total management when compared to the systemic use of medications, say like either Kashayam, Churnam, Avalehi, and all those things. Those things can be reduced, like taking a pill. Leave that, take this. No, need not be. And don't leave that, also take this is also not correct. Needs to be evaluated, and certainly we can give good results. With Panchakarma, long-lasting results are achieved.
Okay, doctor. Okay, doctor. Okay, doctor. Thank you, doctor. Doctor, generally, even if we don't have any health conditions, how often Panchakarma has to be done, doctor?
Better it is to take once in a year. Generally, we have a Dinacharya and Ritucharya that has been explained in the basics concepts of Ayurveda, for which the Ritucharya is the one which advocates, in particularly Varsha, Rutu, Virechana, and like that. It advises once in a year, a deep detox with Panchakarma will make you live longer, a quality life without suffering.
Okay. Okay, doctor. Okay, doctor. Thank you, doctor.
Thank you.
What is Ritucharya?
Ritucharya is the seasonal recommendation of the daily routine. Dinacharya, Ritu is
Ritu.
season.
Yeah.
Varsha
I
Rutu,
get.
Grishma Rutu, Sharad Rutu. Yes.
Yeah.
Doctor, if you have time, can you explain Ritucharya, like what are all the activities to be done during each season?
Ritucharya, we can certainly we can have one. Madam, please.
No, I was just telling that let's finish the Panchakarma detox related questions first, because the agenda of this session is Panchakarma detox. Definitely,
Yes.
we can have another webinar for Ritucharya. As
Yes,
each of
Nidhi.
our doctors are so knowledgeable, definitely it will take time. So let's go for the questions now. Dr. Gopal Krishna, over to you.
That's correct, madam. That's what I wanted to tell. The Rutacharya dealing with Rutacharya recommendations for Vasant Rutu or the present continuing Grishma Rutu and all those things. It's a very elaborate subject. We need little more time to explain that. Let us this time at this juncture let us stick on to Panchakarma and related problems. Yes.
Okay, doctor. Thank you.
Namaste.
Question?
Doesn't seem to be any questions there. However, I would like to bring up a question which was asked in one of the earlier webinars conducted. Yes, so among the Panchakarmas, I think doctors have already explained when to take what and under what needs both the indications and the contraindications. However, to understand for a layman, is there something if they have to plan for a detox, which is the best detox they have to go for it? Is there anything like a best detox? I am a healthy individual and I want to take this. I want to take this detox as yearly detox is needed for everybody. I think we have an excellent comparison. We tell how we maintain our vehicle, right? Yeah, every year we give it for service. Similarly, our body need to be maintained as well. So that way, if a healthy individual want to take a detox, which one they should go for? Doctor, you want to take this question?
Yes. Can I?
Yeah, please.
Yes. Say here the Shodhana Karma, that is the Panchakarma, is targeted to balance Vata, Pitta, Kapha, the Tridoshas, and also take care of the ama that has been taken place or stored in the different dhatu levels, Rasaraktadi, Sapta dhatus, and all that. And also to cleanse the malas, three major malas, that is Tridosha, Saptadhatu, as well as Trimalas. For this, the best one is the simple one is and also easy to administer. And as in Ayushvi we are targeting or Ayushvi we are offering rather practicing, Virechana karma can be very easily done at home without much of hassle of getting admitted into a center, Panchakarma center and going all those things. Virechana is the best, I feel.
Okay, thanks, doctor.
Yes, namaste. Namaste.
Yeah, and also we one more question that came up in the infertility webinar. I think we can repeat it here. The question was like, nowadays when the couples are struggling to, these cases have increased. Couples are struggling to conceive. So the first offering that is made to them is the assisted reproduction, that is IVF or IUI. So the question was, should they try IVF and then come to take a detox, or should they first do the Panchakarma and then then see the results? So I think Doctor, you can answer this probably for this crowd as well.
Ramyaji? Okay, let me take this, no problem. And then say in the allied sciences, what we see is if the AMH is less, they directly advise the couple to go for IVF or assisted fertilization. In all such conditions, it is not necessary to go for assisted fertilization like IVF or IUI or any other procedures like that. Ayurveda offers a wonderful management in that, starting with Virechana and also Bastikarma, Uttarabasti, and simple daily Abhyanga. Abhyanga, that is the oil massage, which they can do at home by themselves without going into a therapy center. All these things offers a wonderful result. In my experience of more than 3 decades, I have seen a couple conceiving naturally, not going into assisted fertility centers after undergoing simple Ayurveda procedures, simple Panchakarma procedures.
So, if AMH is high, then
Yeah, then there are so many. AMH is one of the hormonal study that we usually do when a couple come for fertility infertility clinic.
Mhm. But
If AMH is high means there is no problem. No problem. There is naturally. Usually, such people will not come to us. Usually, if it is low, the implantation of the zygote that has formed, all those things, no problem will be there. Hence, the conception is somewhere it is disturbed.
no,
If
no,
AMH is
mine
high, it is normal. Then there will be no problem. Fine. Yes.
it's higher than normal range.
There are many things higher than normal range. They doesn't cause any pathology. It is something like hemoglobin, just let us say. Say normal range is 12 to 14, 12 to 15, even if it is 16.4, 17, it doesn't cause any problem.
Yeah, also to add on, see, AMH is actually an indicator to understand how, what would be the outcome of IVF actually, and also the implantation, as Dr. Gopal Krishna mentioned. So, whether the AMH is very low or it is more than the range, right? I think the Panchakarma detox is something that will kind of balance it and help in the conception, because we have seen a very good number of male as well as female infertility cases conceiving naturally through the Panchakarma therapies, and also, of course, diet and exercise. But these little bit of deranged hormonal issues would not have that much of effect. It can be helped with Panchakarma.
Yes, that's correct.
Yeah. Do we have more questions?
Doctor, can dry skin condition be cured with Panchakarma?
Dry skin usually xeroderma, or whether it is something like the scaly skin related to psoriasis or ichthyosis. There are many conditions which they present with dry skin.
Okay.
Individually, we need to evaluate the case. But anyway, to put it in a very simple word or a simple management to say, they can certainly daily try with the Abhyanga that has been explained in Ayurveda. Abhyangam acharyan nityam sa jarashrama vataha, something like this. Vata is the one responsible for dryness of the skin. That can be alleviated, that can be handled with Abhyanga with the different medicated oils. And routinely, as previously we discussed about the Rutucharya and Dinacharya, yes, this can be very easily offered, very easily tackled.
Okay, doctor. For Vata type, sesame oil is to be used, no, doctor? Sesame oil based things has to be used, no?
Yes, usually the sesame oil, that is Tila is the best for Vata.
Okay. Like, can Abhyanga be done with Dhanvantaram Kurambu or any other oil is there, doctor?
There are hundreds of oils.
Oh.
Dhanvantaram is one of the things which is very widely used. Not only Dhanvantaram, Kshirabala. There are many Abhyanga Tailas available. Depending upon the condition, depending upon the comorbidities, depending upon the all other things, it need not be only Vata causing this. There could be something like even the Pitta, along with Vata and Pitta, the combination of 2-3 doshas can result in some of the skin manifestations. In such conditions, we will individually decide which needs to be used, but usually or generally, it is Tilataila, that is sesame oil.
Okay. Okay, doctor. Thank you, doctor.
Thank you. Thank you very much.
Yeah, please take a screenshot of this slide, and also here, this is our website, and these are the numbers. You can contact us. This is the email. So we will arrange for an online consultation initially to understand the, what kind of Panchakarma therapy you would require. And if you are willing to do it at home, then we will support you there. We'll send all the medicines to your home. Even if there is a blood test needed, we have tie up with ThyroCare. So yeah, and you can do it at home. Only for the massages you can go to our partner centers, or if you want to go to the partner center and do the entire therapy, we welcome you for that as well. So make a note of this, as well as this slide. So this spot offer is valid only for today. Yeah, are there any further questions? Or can we wind up?
See, there is one question. Let me read it out.
Okay.
Each therapy is based on the individual date of birth, place of birth, Prakriti and Vikruti, or do you provide therapy anytime? Okay, Shrikant Ramanagara. So you are asking this question.
We offer therapies depending upon the dosham, balam, kalam, prakritim, analam, vayama, all those things. As he has mentioned about the date of birth, maybe the age is assessed with that, place of birth, where he lives, whether it is Jangala or Anupa, whatever the classification we make according to Ayurveda, and the what therapy, depending upon the clinical presentation of those things. And we offer therapy required for that particular condition throughout. Yes, throughout the year, probably if he refers to, yes, we offer. But depends which therapy, how long, and how it has to be. All modalities needs to be evaluated and planned. That can be done only with the professional approach. That is, through a professional, you can get it done. Through like the platform like Ayushvi, we have many people assigned for those things, and we have that network, and you can approach us. Ayushvi can give you support throughout. Yes.
Okay, thanks, doctor. Apart from that, there is no question. Then we can wind up for the day.
Thank you for the information.
Thank you all.
Thank you for your time.
Thank you all. Thank you,
Have a good
doctors,
day.
and thank you, audience. Yeah, please reach out to us on these numbers and the website. Thank you. Have a good day.
Thank you.
Namaste.
Thank you, doctor.